We had Mikkel Moore, who was with Intermountain, as well as Bill Krim, I think, who was with United Way. And when we were talking about social determinants and the work that they're doing in and around Intermountain, it struck me as what a challenge that is to orchestrate all that data, because it's a different set of data than we normally deal with, but it's so relevant to the health of the population that you serve. Talk a little bit about some of those use cases that Michael was alluding to.
You mentioned earlier the explosion of healthcare data, but to your point, we have to look at a holistic view of the person, not only the data that's being produced from a healthcare perspective, but the other things that need to inform care. Broadly, the change we're trying to affect in healthcare, you think of the way healthcare is operated for centuries is who is coming to me in being seen that has a problem, and then I'm reacting to the problem that they're coming to me with. What we're trying to do is fundamentally change that perspective. So rather than a primary care physician, when she enters the office every day thinking about, okay, who's on my schedule today? What we're trying to do is change that and say, who needs to be on my schedule today? Who do I need to see today? And that's a very different perspective and takes a whole different approach to data and analytics to be able to know who do I need to see. So it's not just healthcare data, but it's also social determinants data and forming a relationship with patients to being able to use that data to affect change. One of the examples that we like to use that was a real patient was the traditional healthcare approach to someone needs a colonoscopy is, well, I'm going to call them, I'm going to try and get on a schedule, I'm going to send a mailer to them to try and get them to get a colonoscopy. And if they don't, well, then I really don't have much of a recourse to get them in and get that preventative care done. What the approach that we're taking is to say, well, they need to get in to see a colonoscopy, but we know that they're probably going to have transportation challenges. We know that they're probably going to have problems or concerns paying for that colonoscopy. We know that there's going to be some follow-up issues that we need to have. And so if we have that information at the ready prior to making that call, what we can do is make sure that we're aligning all of those components up at the time when that call happens and say, hey, how do we get you in for a colonoscopy? How do we make sure you can get to your appointment? Let's take care of any of the financial concerns up front and any of the other exigencies which may be standing in the way of receiving that care. All of that workflow and workload needs to be informed by analytics and a holistic knowledge of our patients. And that's how we're using that data supply chain is not, to your point, let's just load as much data as we can and then hope we can find a use for it. We start with the end in mind, which is, what are we trying to accomplish? What are we trying to get done? And then let's back into it and say, okay, what are the data assets that we need to line up in order to be able to inform and make those decisions?